How you doing? My name is Dr. Ulysses Jackson, and welcome back to a Mental Health Monday. Today we're going to discuss the 10 most common mental health disorders. I want to try to give you guys a great understanding of some and overstanding of what the 10 most common mental health disorders that you hear discussed regularly. The first one is going to be anxiety. The second disorder, personality disorder. That's when that narcissistic disorder comes in. But there are 6 more other personality disorders that very rarely discuss. That post-traumatic stress, that PTSD, stress and trauma-related disorders, depressive disorders, bipolar 1 and 2, OCD, which is that obsessive compulsive disorder, the autistic spectrum, and finally, schizophrenia and ADHD. So those are the 10 common mental health disorders that you usually hear. Most people don't even know the connection between bipolar 1 and bipolar 2, which are 2 different bipolar and manic depressed moods when it comes to mental health disorders. So I want to try to let you guys get a better overview of these 10. So the first one we're going to be discussing is anxiety. Anxiety, as defined, is a chronic condition characterized by an excessive and persistent sense of apprehension. The types of anxiety include generalized anxiety. This is when you're anxious most of the day, most of the time, about everything. Paying your bills, going to school, going to work, your relationships. You're just anxious about everything. Then we start to get more specific. We start talking about social anxiety. That's going out in social settings, being around people, and being in public. Then we have the obsessive compulsive disorder, which is also falls under the anxiety spectrum of that behavior of being anxious with obsessed and compulsive, doing things with that behavior that would be considered compulsive and obsessed. Next, we have these personality disorders, which enduring rigid patterns of thoughts and feelings and behavior significantly deviate from the culture's expectation. See, we also got to understand that from each culture, certain behaviors are accepted, certain behaviors isn't. So if you're coming from a culture where going to an elder to discuss things, we have to be aware that what's your cultural standpoint? Some other people in other cultures may go to the medicine man to deal with the anxiety. And in American culture, you'll go to your local pharmacy for some type of medication, When in other cultures, it could be talk therapy or there could be their own rituals, the way they handle it. So make sure that when you're dealing with all these disorders, it's in the content of the culture and that culture's expectations. So as we get into these personality disorders, each culture looks at them differently. So the paranoid personality, schizoid, schizopal, antisocial disorder, borderline, histrionic disorder, narcissistic, avoidance, dependence, and obsessive compulsive personality disorder. Now I want you to get a look at those disorders, because if you think about it, which one of those personality disorders do you not know? Which schizopal? Do you know what that is? If not, you could look in your Google, you could go to the DSM-5, and you could look it up. Because sometimes we put labels on people, and sometimes we put labels on each other, such as, you're a narcissistic. But when you say to me, he or she is narcissistic, we're talking about a personality disorder. What are the traits of a narcissistic person versus that of a dependent or antisocial or borderline? This is what separates some of the recovery coaches and licensed practitioners from others. That we as licensed mental health counselors, we have to be very clear and precise with this. Which brings me to my disclaimer. My name is Ulysses Jackson, Dr. Ulysses Jackson. This slide, this information being shared is for educational and informational use only. It's not to be taken as therapy or in place of therapy or counseling. If you're suffering or have experienced any of these mental disorders, please seek help or professional assistance by calling a provider or your provider on the back of your insurance card to get more precise help. So these are the personality disorders. The next one we're moving into is that post-traumatic stress. So in the short term, what is PTSD? It's a disorder that's developed after following a traumatic event, 9/11, watching somebody die, car accident, which leads to flashbacks and severe anxiety that are uncontrollable thoughts of that event. And a trigger could trigger that. That's why, like, a lot of people that living vicariously through that trauma of 9/11, every time 9/11 comes on, it's going to take someone's thought back where we lost a father, a mother, a sister, a brother, a wife, a loved one. We can suffer from this vicarious trauma through hearing the stories through other people. So to really get a precise diagnosis of this post-traumatic stress, please seek out your healthcare provider and a professional to find out if you have the features and characteristics of post-traumatic stress. Next, we have the stress and trauma disorders, which I went in depth on one of my previous slides, on my previous presentation. This is a response to distress and disturbance. It overwhelms a person's ability to cope, and they have physical and mental symptoms of stress. Paying your bills could be stressful. The holidays could be stressful. Where you're going to go for spring break could be stressful. How you're going to pay your bills could be stressful. These are common mental health disorders when we talk about stress-related disorders. Depressive disorders. Severe dependence and dejection typically felt over a period of time, accompanied by a feeling of hopelessness and inadequacy. This is why we have to gauge when someone says they're depressed. Is it mild? Is it moderate? Or is it severe? Is it depressive with suicidal thoughts or homicidal ideations? This is where we have to really come in as mental health practitioners and give them a thorough evaluation. The depressive disorders varies on the type of depression you have. It can be disruptive mood dysregulation. It can be MDD or major depressive disorders. It could be persistent depressive disorders that have been lasting longer than 6 months and going on and on. That's why they use the word persistent, because it's been going. And for the women, they can go up and down and get real depressed when it comes to that premenstrual disorder. Substance medicated disorders. You were real high, you got real low, the drugs are gone, the money's gone, you have to go home. You have to go face the music, as they say. This is what we call a substance or medication-induced depressive disorder. When you look at, I've been binging for 18 days, I went to Vegas, I lost all the money. Now I got to go home and tell my wife that I gambled all the money away. So now you've created this disorder from your behavior and substances. Or you could also have depression because of another medical disorder. Bipolar. And we kind of touched on bipolar. It's a mental health condition that leads to extreme mood swings, including emotional highs, mania, hypomania, and lows. So you might see somebody bouncing up and down off the wall, bouncing up and down off the wall. And you have to understand that bipolar 1 is different than bipolar 2. Bipolar 1 is more severe, and the person may be hospitalized to stop them from injuring themselves or others. There are certain criteria that has to be evaluated to find out if you even have bipolar 1 or bipolar 2. OCD, obsessive compulsive disorder. This is a mental health disorder that influences the pattern of unreasonable thoughts and fears of obsessive, leading to repetitive behavior. So this is that you leave the house, you get halfway to work, you come back, see if the door was locked. This is that you wash your hand after you use the bathroom and you go back 10 times, continuously washing your hand. That's that obsessive and that compulsive, which we have to work on, find out what are the triggers, what's your thought pattern to make you believe you have this. And OCD also, it affects your daily life. The autism spectrum. This is a neurological and a developmental disorder that begins in early childhood and lasts throughout a person's life, affecting how a person acts and how a person interacts and even learns. Common characteristics that varies from individual to individual. Schizophrenia. This is what they consider and classify and cluster as a psychotic disorder. This has severe mental disorders causing abnormal thinking and the perception. 5 features must be present: delusions, hallucinations, disorganized speaking, grossly disorganized or abnormal motor behavior with other negative symptoms. So when someone starts to hallucinate, that alone, does that mean you're in a schizophrenia spectrum? This is why this evaluation is so severe and so sensitive. And we have to know what this is. So what I want to do today, I want to give y'all some input on when you start saying mental health, at least know the 10 common. Because a lot of people just say he or she is narcissistic. Understand that there are other personality disorders associated with that. Understand the schizophrenia, the cornerstone, delusion, hallucination, disorganized speech, and motor behavior. ADHD. This is that attention deficit disorder. Now, the hyper, you have 3 types: predominantly inattentive type, hyperactive, impulsive type, or combined. You could have all of these features going. This is why the importance of seeing a licensed practitioner to find out, or if you have ADHD, is it mild, moderate, severe, and is it hyper? Or is just your attention span very low? Or do you bounce off the wall? The primary symptoms and the criteria to diagnose ADHD, it has to last for 6 months in 2 different settings. So the kids that say they got ADHD, understand that the doctor or the practitioner is going to look for, well, how long has he or she been displaying this behavior? Has to have been going on for 6 months or more in 2 different settings before the age of 12. That's school, church, home, friend's house, with significant disruptive functioning. There's a misconception of what ADHD is, and it impacts people at different stages of their life. So again, this is Dr. Ulysses Jackson. I appreciate y'all following me for this discussion of understanding and overstanding what are the 10 most common mental health disorders discussed. Make sure you remember to hit that like button and subscribe, hit that notification, where every Monday we're going to come with a new topic of something that you want to discuss on Mental Health Mondays. Thanks again, Dr. Ulysses Jackson, Mental Health Mondays.